Chapter 15, the Autonomic Nervous System, Screencast 4. This screencast will be focusing on autonomic nervous system tone and reflexes associated with the autonomic nervous system. Now, when we hear the term tone, typically this is referring to a given state of contraction. We're now going to apply this term to the autonomic nervous system. One thing to remember, most effectors are going to be innervated by both parasympathetic and sympathetic activity. They are continuously releasing neurotransmitter, and the result of this is autonomic tone. In some instances, only one division will be controlling the status of an effector. When we talk about blood vessels, for example, they are generally in a partially constricted state, and this is attributable to sympathetic tone. We use the term vasomotor tone to describe this condition. Vessel will constrict if sympathetic activity increases. They'll dilate if sympathetic activity decreases. Remember, vascular smooth muscle does not have any cholinergic receptors, so is not going to be sensitive to acetylcholine or the effects of the parasympathetic nervous system. Vagal tone, on the other hand, refers to the fact that the heart at rest is dominated by parasympathetic control, and this is going to result in a lower heart rate than if the heart rate were to be unmodified or unregulated in any way whatsoever. Now, dual innervation is a really critical concept to understand, and what this means that organs are receiving input from both branches of the autonomic nervous system. They are getting both sympathetic and parasympathetic activity. Now, this can result in one of two types of effects. It can be antagonistic, in which sympathetic, parasympathetic oppose each other, or it could be cooperative, where they actually work together. If we look at the most common relationship, it is antagonistic. The control of heart rate is a perfect example. Parasympathetic activity will result in a decreased heart rate, whereas sympathetic activity results in an increased heart rate. So this identifies the fact that cardiac cells have receptors that are both cholinergic and adrenergic. Another example would be control of the smooth muscle in the digestive system. Here, parasympathetic activity will increase motility of the GI tract, whereas sympathetic activity will decrease. So once again, this demonstrates that GI smooth muscle has both adrenergic and cholinergic receptors. When we look at pupil diameter within the eye, parasympathetic activity will decrease pupil diameter, whereas sympathetic will dilate the pupil, make it larger. Now, when we look at cooperative effects, this is not something that we see very often. Now, here we're looking at parasympathetic and sympathetic stimulation have different parts of an overall response. Probably the best example we have is male sexual function. The erection of the penis is due to parasympathetic activity, whereas the ejaculation associated with orgasm is due to sympathetic activity. Both are required for the male sexual response. Now, sometimes we have opposing effects that can be achieved without dual innervation. So as we saw previously, blood vessels constrict with increased sympathetic activity. They dilate with decreased sympathetic activity. If we look at some other examples that only have sympathetic activity, sweat glands within the trunk, the erector pili muscles in the skin, and the adrenal medulla neurosecretory cells. Now, there is one condition out there that is actually due to exaggerated local sympathetic activity. This condition is known as Raynaud syndrome. And what happens in individuals that have this syndrome, there is a sudden constriction of the small arteries of the fingers. What happens, this will result in skin losing its color, so it's not going to have that normal hue. There is significant pain associated with this, and the triggers can be cold or emotional stress. This is more common in women. I actually have a friend whose Raynaud's syndrome is so severe, she actually has to use gloves when she's consuming a cold beverage. So a pretty severe situation of this condition. Now, there are drugs out there, and many of you that have had your eyes examined know that these drugs can impact the size of the pupil. If we look at parasympathetic division, that is going to result in the constriction of pupil, whereas sympathetic will result in dilation. There's this drug known as tropicamide, and what it does, it blocks the muscarinic receptors, and it causes the pupils to dilate. So kind of imagine when you're having an eye exam, quite often one of the procedures that's done, the pupils are dilated so they can actually see the retina in more clarity. There are also drugs such as amphetamines, cocaine, PCP, LSD. They all also have an impact on the pupil and will result in dilation of the pupils. Now, the next topic that we want to address are autonomic reflexes. These are referred to as visceral reflexes. In Bio 144 AMP1, you talked about musculoskeletal reflexes, such as the withdrawal reflex, the cross-extensor reflex. These are going to be reflexes that are specific to the autonomic nervous system. So the effectors are going to be smooth muscle, glands, and cardiac muscle. Probably one of the more important reflexes that we will talk about will be the cardiovascular reflex. It is a reflex that comes into play when there are changes in blood pressure. You may see this described as the baroreceptor reflex, and is more commonly referred to as that. There are stretch receptors in the walls of vessels, particularly the aorta and within the carotid bodies, and they're going to respond to changes in pressure, either increases or decreases. I prefer to address a decrease in pressure as it is a much more serious condition that the body will respond to pretty quickly. So when pressure drops, there are signals that are received by the cardiac control center, and here we're going to see an increase in sympathetic activity, causing an increase in heart rate, an increase in vasoconstriction, and that will result in an overall increase in pressure. If pressure is elevated, then we're now going to be looking at activation of the parasympathetic system, inhibition of the sympathetic system, and we're now going to see a decreased heart rate and a decrease in cardiac activity. This will result in a decreased blood pressure. Typically, the body is going to respond more aggressively to a drop in pressure as opposed to an increase in pressure. Now, there are two reflexes that we are not going to go into significant detail at this point in time. They're spinal reflexes. And these two reflexes, the defecation reflex, also tied in to the gastrointestinal reflex, and that once again is for defecation. It is a spinal reflex. Another spinal reflex is the micturition reflex, and that is responsible for urination. We're going to talk about these reflexes in much greater detail when we address the corresponding systems, digestive system and urinary system, later in the semester. Now here, just to illustrate this example of the autonomic reflex, we are looking at the micturition reflex. Now notice within the bladder there are stretch receptors. So as the bladder fills with urine, this is the activation. So we're going to see sensory signals that are going to move into the spinal cord, and then they're going to be processed within the integration center, which is the spinal cord. Now there's going to be communication with an interneuron. And now we're actually going to have the output, and the signals are transmitted along this motor neuron, okay? And the effector is going to be the detrusor muscle, and we're also going to be looking at the urethral sphincter. So as the bladder is filling, the goal is to empty the bladder. So we're going to see contraction of the smooth muscle wall of the bladder, known as the detrusor muscle, and the internal urethral sphincter will relax, allowing urination to take place.